Hello, I'm Dina Ladd, the Executive Director for the Missouri Cures Education Foundation. We are so excited to kick off our 2022 Women in Science, Entrepreneurship, and Research virtual events this year. We have been virtual the last 2 years, and we're hoping maybe we can reevaluate everything this summer and then possibly meet in person, because we miss the networking and we miss seeing everyone's smiling faces. We have a great event planned for you today. We're featuring women out of Springfield, Missouri. I'm so excited, my hometown. We have an amazing keynote speaker for you too, who I would like to introduce to you. Dr. Carolyn Henry is the Dean of the University of Missouri College of Veterinary Medicine. Previously, she served as Interim Dean and as Associate Dean for Research and Graduate Studies. Dr. Henry is an oncology researcher who served as a faculty member at the Washington State University College of Veterinary Medicine for 4 years before joining the faculty of the University of Missouri in 1997, where she became the university's first American College of Veterinary Internal Medicine board certified oncologist. She is a total rock star. I'm excited to also say she's a good friend of mine. So Dean Henry, take it away.
Thank you so much, Dina. It's a pleasure to be here. Even if this hadn't been planned to be virtual, many of you may be experiencing the same weather that we have here. So I'm not just virtual, I am at home. So if my internet goes out, we've got a backup plan. So hang in there with us. I want to start out very briefly by introducing our panelists, and then we'll start on the presentation, and then we'll have some time for questions and answers. So first up, Heather Manley. And Heather is the Director of Research at ClinVest Research. Thank you for joining us, Heather. Next up is Tayo Abafemi Ajayi, Associate Professor of Electrical Engineering at Missouri State University. Welcome, Tayo. And we have Dr. Amanda Cox, the MSN Chair of Cox College. Welcome, Amanda. And finally, Dr. Natasha DeVore, Assistant Professor of Chemistry at Missouri State University. Welcome, everyone. I'm looking forward to having you share your stories. And I thought I would kick it off with my story and do it very briefly. And this is more intended to kind of set the tone for what I think we're going to be talking about later as the questions come in. I'm going to try to screen share here. All right. Is that showing up for everybody, Dina?
It is,
Yes,
Carol.
yes,
Okay.
It looks great.
All right.
Thank you.
Well, it looks great because I'm using the logo for this session of Women in Science, Entrepreneurship, and Research. And these conversations have always been really fun to both participate in and to listen to, because I think we as women in STEM fields especially have, we've met some challenges, and we'll talk about those today. And I just wanted to start off by talking about fear, because I think the greatest limitation we place on ourselves is fear. And so when we talk about why you do or don't make certain decisions, why you take certain leaps in life or you don't, it usually boils down to a fear of failure. And I think somehow that's probably even more true for women. But I want to turn that. And instead of having a fear of failure, I want to talk about how we as women can make that a failure of fear. And we can overcome that and not have it be something that keeps us from reaching our full potential. So I'm going to go back a little bit and give you just a snapshot of who I am, and then we'll have the panelists do the same in conversation. This is me as a kid. Obviously, I had no fear of dressing horribly or letting my mother cut my hair. And I think as kids, we start out with that natural curiosity. We don't really think through consequences, and so we don't have a lot of fear, but that builds. This is also the age where most kids decide they want to be veterinarians. And so for me, I was already, at this young age thinking about what I wanted to do with a career. And I knew that I wanted to work with animals. And lots of kids say that. Lots of kids grow up thinking they want to be veterinarians and they decide against it. But it was just a very strong inner pull for me. And I ended up in part of grade school and high school in Kentucky. So I had some exposure to equine medicine as well. But Kentucky didn't have a vet school. And so the place that had a contract with Kentucky was Auburn University, which at the time I thought was in Georgia, and I had no idea where I was even applying. But they took 32 students from Kentucky, and we were in-state residents through that program, and that sounded like a great deal to me. And so I'm really going to fast forward, but the 4 years I spent at Auburn were some of the most challenging to that point in my life. I did graduate in 1990. In the course of those 4 years, I had started vet school with my high school sweetheart. He was not a veterinarian, but he moved with me to Auburn. And through the course of those 4 years, we ended up changing plans quite a bit and divorcing. And so I was fresh out of school, and this on June 5th, had just changed my name back to Henry, and I was starting really to reinvent myself in this new role. And I had planned to go to Florida. My goal was always to be on the Gulf Coast and have a small clinic, have very regular hours, and the nicest clients ever, and the wonderful dogs and cats they brought in. As it turns out, I did not pass my national board exam to the score that you needed for the state of Florida. And back in those days, each state had their own score that they would accept. And so right out of the bat, I felt like I had failed in a marriage. I felt like I had failed at really getting into my profession the way I wanted to. And so that's carried with me. And I admit that up front, because I think this is a safe place for us to be a little vulnerable and talk about, what our challenges are and how we meet those. This is what I had coming out of vet school. I had my dog who was ready for the beach, but I couldn't go to the beach. And I ended up taking a job in practice outside of Montgomery, Alabama, in a town called Prattville. And I very quickly got bored with that. I felt like I had a lot of education. And at that time, if you couldn't fix the animal for $50, the client wasn't going to treat. And so it was kind of a depressed economy. We were in the first Iraq War. A lot of the clientele I had there were military, so they were being very cautious with spending. And it just wasn't what I dreamed. And I thankfully had the courage to say, this isn't what I want to do the rest of my life in this capacity. But I'm very interested by cancer patients and oncology patients, and what we can do to diagnose that more earlier and allow us to have better therapies. And so I decided, well, you know what, I'm going to do an oncology residency, and I'm going to specialize in that. Well, the next problem was Auburn didn't have an oncology residency at the time, and there were a few other schools that did. I wasn't really in a position where I could move. And so I actually went to Auburn, and I offered to do an unpaid residency if they would allow me to moonlight at the emergency clinics in Columbus, Georgia, and in Montgomery, Alabama. And so I took that on, knowing that I was not going to get paid, but they actually had to pay me because they couldn't give me a parking pass without that. So they decided they would pay me $1 a month. And so I still have these checks. They're getting very faded. But I will show you that not only was it $1 a month, but they did indeed take taxes out. And so I started out with not a lot of self-assurance. I had doubts about myself, and this didn't help. But I knew that I was going after a dream that really I had a passion for, unlike what I was experiencing in private practice. And you'll note the check below that, I actually went up. In 1 month's time, I went up 2 cents a month. So that's how quickly I rose through the trenches. And during that time, I also got remarried. I married a food animal veterinarian who was on faculty at Auburn, and really changed my whole perspective on academic medicine. The other thing that changed my perspective on academic medicine was getting a job offer for $55,000 at Washington State University back then. And compared to less than $12 a year, that sounded pretty good. And so we loaded up the truck. We both got faculty positions and we went across country in about 4 days and started at Washington State University. Washington State University is in the eastern part of the state, so fairly isolated. It was a very new culture for me, but I did grow to enjoy it in the town. I always felt a little bit like a poser, though, if that's a word that resonates with you, or an imposter. I was brought in, they didn't have an oncology service, so I was teaching in internal medicine, and I was teaching about infectious diseases that I had never in my life seen, and my training was in oncology. And so it just turned out it wasn't a good fit at the time for me, and it became a poor fit for my husband as well, with some administrative changes. And so we were often looking for an academic institution that needed a large animal vet and an oncologist. And at the time there were two that were doing that, and that was K-State University and University of Missouri. And we chose University of Missouri in part because of having a medical school on the same campus. So packed up again and went off to University of Missouri in 1997, thinking this was probably a stepping stone to our eventual place we were going to be. Now, if you're not familiar with the academic process of getting tenure, it's a 6-year process initially, and after 3 years, they do a mid-probationary review to let you know your chances are good or bad at making it through the tenure process. And so, just when I was starting to become a little more confident, I got my review back from my 3rd year review, and this is one of the lines directly from that. It said, Dr. Henry is an opportunistic clinical researcher with a variety of interests. I'm pretty sure that was their way of saying she lacks focus and she doesn't come up with her own ideas. And so not off to a real strong start there. And then if you read further into it, there was even more. We've provided our opinion and recommendations regarding the direction of Dr. Henry's academic performance in this department, and it's difficult to believe that she will successfully complete the promotion and tenure process without a strong deviation from her current effort distribution and a reorientation of her priorities. So again, just as I was starting to feel like I was getting in my groove, got shot down, and it was, you've got 3 years to fix that or you will be dismissed from the university. So I have faced this fear over and over again in my career. And I just bring that up because I think it helps. It's always helped me to know that I'm not the only one and that other people have been able to rise above some of those challenges. But at this point, I was feeling like I was in Loserville. Well, I kept doing the things that I felt like were important to the job, and that included training residents, training the next generation, and that's was a great passion of mine. And so if you look at the picture above, that was a few years later when we had really grown the service and we had a full complement of faculty and residents and technical staff. In the meantime, wrote a textbook, and also worked on the human side with folks at the medical school for some comparative oncology projects. And through that, I did make tenure. Still felt like a poser, but I felt like there was less chance I would get fired. So I had that going for me. And, I sort of got to that point. I was always waiting for the next thing to happen and wondering what that was going to be. But I was married to a fellow faculty member who was bringing out the best in me, and we were not only a successful academic couple, but we felt like we were going to be living happily ever after. And then, as fate would have it, my late husband had a heart attack in May 17th of 2009. Interestingly, he wrote the statistics chapter in my book, and he had just finished all of his edits early, as he did everything, and completed all the tasks 2 days before his death. So even to the end, he showed tremendous effort. And so my world kind of crashed at this point. We had a number of kids, and the exact number at that time was 8. We had 3 older kids that he had when I married him that were toddlers and a little older. He and I had 3 children, and we had adopted 2 sons from West Africa. And so I went beyond fear to complete panic at this point. It was, how am I going to be responsible for all of these souls and have a career? And I was just honestly pretty paralyzed at that point, and I needed to reach out to get help. And that's a hard thing for a lot of us to do, but it was absolutely essential at this point. And so this was my new group. And I had, we came together, all the kids dealt with it differently because of their ages, but I think having that responsibility of making things okay for them really helped me in the long run. It took the focus off of myself, and it gave me something that I felt like I had more control over. I could help others. But it did take a recalculation of, okay, what am I going to do with my career now? It's not where I can just pick up and move a whole bunch of kids by myself. And so it became apparent I was probably going to stay at Missouri, at least in the short term. And one thing that really it stuck with me, Jeff was a food animal guy who had a lot of he had big ideas and things that he wanted to do to help populations in other countries, to help food supply be a secure source for them. And this was a little spoof where I dressed as him and he dressed as me. But I really wanted him to be able to have started something that was lasting, and I didn't want to see those things go by the wayside. But as a small animal oncologist, I really didn't have a lot of business working on those types of initiatives. And fortunately for me, there was a program that was starting about a year later called Mizzou Advantage, and it was all about bringing people together from different backgrounds. And there were what we called facilitators on campus, and I was chosen as what we call the One Health, One Medicine facilitator, to put together teams with all the expertise on campus from many different areas, and make this work in a more sensible way for the university resources. So through that, I got to meet tons of people on campus from all different backgrounds, and that's really been the greatest part of my life is those interactions with people that think differently than I do. In addition to becoming that faculty facilitator, in 2012, I was made Associate Director of Research at the Human Cancer Center, which is Ellis Fischel Cancer Center. And I also had by then fallen in love with a fellow widow, and he was the one in the middle, and the 2 sons to his right were 2 that got added to our collection. And so there are 10 total. And that has far exceeded any number of kids I ever thought I would have, but it's been a blessing in every way. So I started feeling like, okay, things are coming together. I feel like this is home. This is a place I can grow in. But I still didn't have that self-esteem. And I hope we'll touch on that. The whole imposter syndrome thing, I'm not good enough. I'm in a position that I'm not really capable of doing. I hope that resonates with some of you, because it was a hard lesson for me to learn, and one that I think we need to mentor each other out of, that type of thinking. And the biggest hang up for me was I was afraid I wouldn't be seen as a researcher. I did clinical trial work. I did studies in animals that have naturally occurring cancer, and it was to find therapies that would help them, but then translate hopefully down the road into new treatments for people. And I worried a lot about, I don't have a PhD, I'm dealing with folks in the human medical field, and I'm not going to be looked at seriously. But this kind of brought it all together for me, and that this was the sign they put up at the hospital for my office. And the degree they gave me, it was supposed to be a Master's of Science and a DVM, so a comma between them. And I realized they're not looking at my degree, they're looking at my results and my outcome and my vision. And I think that's an important reminder. We get labeled sometimes by ourselves, and others don't necessarily use those same labels on us. And so we need to be cognizant of what our strengths are and dwell less on what we think are our shortcomings. And so shortly after this, I also got named Associate Dean for Research at the College of Veterinary Medicine. And so I really had 3 jobs at once but they all intermingled, and it was just a constellation of jobs that allowed me to really put people together and make things happen. And that's where I think the fun of many of these jobs are. And then the dean of the vet school had decided to leave rather unexpectedly to me. He named me interim dean, and then 6 months later, I was named permanent dean. And what I didn't realize or think through initially was that I was the first female dean for the college. And I've never really felt that threatened in being in what used to be a male-dominated profession. But the female students actually said, well, you put your picture up on the wall so that other people can see it, because this is the pictures that were here were basically everybody that came before me. And they usually don't do that until after you leave the position. But the students, as I said, they requested it because they said it's important for especially women to see that women can be in leadership roles. And so despite my misgivings about having to look at my picture on the wall, I went along with it, and we now have that representation, which I think is both symbolic and important in terms of giving our younger students an idea that there's some mentorship out there for them. It's been a wonderful run. I've been able to work with other strong women, and I've done others of these conferences and met some great women through this. I get to welcome people into our profession every year and know that we are having an impact in their lives. And I get to do things like graduation in the midst of a pandemic, which I actually pulled it off, other than I got censored because I referred to veterinarians as the MacGyvers, and I said we could MacGyver out of any problem. And so if nothing else, I pride myself in being relatable. So I'd like to talk about, not letting fear stop us from our goals. And this is a saying that I've always taken to heart, and that is leap and the net will appear. I don't recommend that to my children, but in a way we have to do that sometimes. We have to just, have the gumption, as they used to call it, to go ahead and face some of these challenges. And we need to be fearless. So that's where I'd like to kind of start the conversation of what these great women on this call have experienced, and how we can make sure that we don't have a fear of failure, but we have a failure of fear. I'm going to stop sharing. And if I could ask all of our panelists to pop up your picture. There we go. All right. So we're asking everyone to stay muted in between questions. I'm going to ask some questions, and then as they come up in the chat box, we'll try to address those as well. Adina's going to help me keep an eye on those. So I think the first question I'd like to ask is, I've talked about how I'm not where I thought I was going to be. I'm a long way from the Gulf Coast in private practice, but wouldn't trade it for the world. And I'd like to start out by saying, many women do end up in different careers than they initially imagined. And I know that that's true for some of you. So if I could, I think I'll start with Amanda and just say, what advice would you give to those who are just starting over, and do you have a little background about you that gives you a unique perspective on this?
Thanks, Dr. Henry. First of all, I wanted to just say thank you for the opportunity to speak here today. Your presentation was so inspirational, and it is so neat and interesting to hear stories of women who are coming from circumstances that are prohibitive, circumstances that make them feel like they're not welcome or that they're not supposed to be where they're supposed to be, but they persist because they know that this is exactly where I'm supposed to be. It's just such a neat story to hear, and just thank you for sharing it with us. The question that you asked about, whether I'm doing now what I thought I was going to be doing when I started my career, what advice do I have? I will say this is a perfect question for me, because I started out my early college days as a musical theater major. I grew up in poverty. I grew up as a student who really, I boxed myself into this identity as a theater person. You know, I was a person who loves show tunes, and I love to get on stage and show off and, you know, sing and dance and put a pretty costume on and, you know, get attention from people. But I found out very quickly in college that this was not something that was going to be sustainable for me as a career. And I had to do some real thinking in and of myself. What kinds of things am I capable of doing? I had never given myself in high school the opportunity to really explore any other pathway or any other avenue. And I think we do, as young people, try to box ourselves in to identities. And we say, this is who I am as a person, and this is who I'm always going to be. And a little bit later in my career, I took a step back and I said, actually, I am a person who can succeed in the sciences. I can do well in anatomy and biology classes. I can do math. I can do these things. It doesn't come naturally to me like the other things did when I was younger, but if I sit down and apply myself to these areas of study, I can do it. And so by giving myself sort of that window of opportunity and saying, you know, in terms of imposter syndrome and self-esteem and not belonging, I had all of those things, and I still struggle with those things to this day. Do I belong in a room full of researchers? You know, yeah, I do. I have just as much interest. I have just as much right to be here. And, you know, I think trying to take those labels off, I think, is really important. And so I would say, don't box yourself in. Don't put an identity on yourself. Don't put a label on yourself. Just allow yourself to experience and explore all those different possibilities within your career, because you might be surprised like what kinds of pathways they may take you down and what you can do in those areas.
Well, I didn't mean to disappear there. Sorry. Tayo, I saw you nodding your head during some of Amanda's answers. And Amanda, I love that. Don't box yourself in, keep your options open. And I feel like that may resonate with you as well, Tayo. Can you give us some advice of getting yourself out of that situation?
Yes, and Dr. Henry, I hope I don't start crying because your story was just so inspirational. So thank you for sharing. I definitely agree with what Amanda shared, and I was just coming from the perspective of tenacity, not giving up, because for me as a young girl, I knew what I wanted to do was do something that involved math and physics. I loved those so much, and so I ended up going for engineering, and I had an engineering internship. But I loved the college atmosphere. I loved tutoring. I loved every opportunity to do undergraduate research, and so that's how I knew I wanted to do academia. But then I had some challenges during my master's program, and anyway, but because I always kind of looked back inside me and I just felt like the college was where I belonged. And so as a result of that, you know, I stayed back, took a job in college before I went on to my PhD, because I guess after my master's, I was just like, forget it, I'm done with it. But then it was like, gotta be true to, you know, the calling inside of me. And so stayed and pressed on for my PhD. And for the very first time, I mean, I graduated, I was a commencement speaker for my graduating class in Chicago. You know what I mean? So like, you know, undergraduate degree on top of the world, master's degree was kind of where I was like, So then restarting the PhD was just having to deal with that, you know, and that was when for the very first time I felt the imposter syndrome. But anyway, I'm thankful for the help and support I got, because that really built the confidence in me, and ended up being the commencement speaker for the for our graduate program when I graduated for the PhD. But then after that was then getting the job, because, you know, wanted to stay back home and have kids, and, you know, and I was enjoying that, but then it was this part that was still missing, like, kept looking back inside me. There was just a discontentment. So that pushed me to, you know, get a postdoc and, you know, but just, you know, tenacity, just stay on, and eventually get a full-time faculty position, and just feeling like now I really belong. I mean, I'm what I wanted to, where I wanted to be and what I wanted to do. And so I think the advice I will give is, don't let go, keep reevaluating, keep assessing, keep reflecting and looking inside and relying on the support of others. Because I mean, personally for me, I'm thankful for the hiccup I had along the way, and just the support. And now I go in search of others on my campus just to help out, but don't let go of that dream. Just press in and be persistent.
Well, and I love how you guys, it's like your whole facial expression changes when you talk about when you realized what you wanted to do and you started realizing how to do it. So that's fantastic. One of the concerns that I've had, and it's not so much in my profession because it's really flipped in veterinary medicine, but in most of the STEM fields, we've really been working to get more women in the STEM fields, especially women of color. And Natasha, we've talked a little bit about this. Can you give us a little bit of insight on what it's like to be a woman in the STEM field?
Sure. Thanks once again, Dr. Henry. Your talk is truly inspirational. Oh. I think what is funny is, like, in the STEM field, we've made a ton of progress in the past couple of decades. And like, as a chemist who's a woman, I didn't even notice there was inequality between the number of women and men until I hit the faculty level. And then all of a sudden I was like, oh, wait, I'm the only woman in the room. What happened here? And I think in some ways that just might be a mark of progress and how slow that change happens. But I think there's a lot we can do about that in terms of encouraging other women who are younger than us to continue to step up and show them and talk about our story and act as mentors for them and encourage them and let them know that, yeah, it's possible. This progress is slow. We don't see it as quickly as we'd like, but you can do it. I think another real aspect of this is just working on flexibility, knowing that things don't always work out the way you think it's going to work out, and still have that tenacity to continue on with it. And I think that's just a huge part of getting women into the field and encouraging women to continue to work on this is, yeah, we can work on this together. We can come up with solutions to kind of help women reach the point where they can succeed at these faculty levels.
That's awesome. And Taya, do you have any comments, in terms of the lack of diversity in STEM fields?
Yeah, I mean, personally for me, it is real. It's real in engineering. It's real in my classroom. And but I feel like if I could just, if I could address not just the women but the men, if there are any men in the room, I think it's gonna take from both ends. I feel like one of the voices that made me persist for my PhD was just one of my faculty. There was a guy, as an undergrad that knew me and I'd been in his office, done research with him. And he was just like, there is no way you're not going to do your PhD and you're going to do it under me, and just pushing. And even as a postdoc at Missouri S&T, one of the reasons I'm where I am today is because Don Wanch, one of the faculty over there, just kept pushing, and just, whenever I'm like, oh, forget it, I can't do this. Like, yes, you can do it, And so, I feel like I am where I am today because I stand on top of the shoulders of giants, people that have helped me. And I think personally for me, it's a personal mission. And so even in my classroom, and I have relatively small classrooms, so it's very easy to spot my girls, and it's just very easy to have that connection, and I'm thankful for that, but I feel like even reaching out, to young faculty, and I say that because, I'm in academia, but I think it's so, so important. Sometimes we get so busy about, pursuing our career and advancing ourselves. And for me, I have a lab and I have students in my lab, and it's finding that intersection of, I want them to leave my lab advancing in their profession. And that's whatever I can do to bring students of color, to especially female, whatever I can do, I go for it, I give of myself, because it's not just about me, it's about the next generation and it's about the future, and we need the diversity.
Absolutely, and that impact. Heather, I'm going to turn that question around. Something I've thought about is if you ask the same question of men, how do you think they would respond?
Yeah, so I think that, first of all, thank you for your discussion and wonderful story there, Dr. Henry. But I think that me sitting on the management side of the position I currently hold and have previously, I think men will probably maybe kind of raise an eyebrow and kind of look at us a little funny of like, what is your limiting factor? And I think a lot of our limiting factors are our self-limiting factors. I think women tend to be the first to jump to say, I need to uphold my family obligations. And I think that we oftentimes are the ones that end up staying home with children. And maybe sometimes that's out of choice, but is it always? Is it still that pressure that we feel as the maternal instincts kick in, and rather that limits our choices in our careers, as opposed to actually, having those open dialogue and open conversations with our partners and let's share this responsibility, share this load so that we can both have successful careers.
Yeah, I love that you bring that up about who takes the responsibility for kids. And I think especially during COVID, when we really all had to juggle that, it's interesting to me that I think sometimes the women just jump in and say, well, I got to go take care of the kids. And, some of that is what we bring on ourselves. But I don't hear men talking about that quite like I do women. And I've always said, if you wanted to carry the kid for 9 months, you would be more than welcome to do so. But yeah, that's interesting. So the other part of women versus men in STEM fields is that there's a salary inequity. And I've got a figure here that on average, entry-level salary for men in STEM and tech fields is more than $4,000 higher than what's paid to a woman with comparable credentials. And so we start out with that salary gap, and then it seems to widen over time. So Amanda, could you maybe give your perspective on how do we address that? If we know that exists, what can we do to fix it? And where does that process start?
Yeah, I think that it's a fact, and it's a reality that women in STEM women in most fields make less than men in those fields. I don't think that I know very many men who would say that that's right. I think that there's a lot of men out there who can help champion, these changes for women as well. I think that the most important thing when it comes to these salary disparities is transparency. I think we have to get to a place where we're in an environment where we can talk about our salaries with our colleagues. We have to just be able to say it out loud. Here's what I make. Here's what you make. Here's what we do, that we do the same thing. Why are we making different things? So I think that until we can get to a place where we can talk about what we make openly with our colleagues, I don't know that it's going to change. And so I think promoting the environment within our workplace where things are transparent, that will help. I know that a lot of public universities have those salary schedules published publicly, but private, entities don't always have that available. So it's going to have to start with having honest, open conversations with your colleagues.
Agree. And Heather, I saw you shaking your head. Anything you wanted to add to that?
Yeah, I'm going to kind of revert back to a little bit of what my comments that I just made about the family life. Unfortunately, as a hire, I know that I am looked at as a young female that has the potential to be of childbearing potential, and maternity leave is a factor, and taking time off to take care of sick children. Until we have a society where that load is more equally shared, whether that's paternity leave. There's a lot of other countries that have paternity leave. It's a norm. And so what that does is brings everybody to the same baseline. Until those ideas, those stereotypes kind of start to dwindle, I think we're going to continue to see this pay gap because of I don't know when they're going to have to take time off. I don't know when they're going to have to leave or have a 12-week maternity leave.
Yeah, and I'm seeing we have a question in the chat box about learned that self-advocacy for raises, et cetera, can be a factor that contributes to the lagging advancement in salaries for women. Anyone want to comment on that? I think that's a great question.
Well, some of that might tie back also to the imposter syndrome. You have to know your worth. And, if you know what value you bring, you need to be able to advocate for that in a way that shows your strength and your confidence. And so any kind of hesitation about whether or not you really belong here or whether you really deserve it, that's going to hold you back for sure.
Yeah, I couldn't agree more. So let's shift gears a little bit about how do we get to that point? Like, if you find that you need support when you're struggling, or on the other side of things, you have a success that you want to celebrate, do you have a go-to group? Do you have a person who is that outlet for you? And I'm going to throw that one to Natasha.
Perfect. I think I've had a lot of different mentors over the years, and they kind of all play their own unique role. My postdoc advisor and graduate school PhD advisor is a huge influence on my life still. She's there to help me when I need good advice. And likewise, even here at MSU, I've found a number of different faculty members who are supportive and are great mentors for various aspects of the job as an academic professor. But also my husband, he's been just a constant source of support over the years. And I mean, even down to the point of changing careers for me. I mean, it was partially for him as well, but having that spouse who's willing to say, okay, let's look at our options and let's look at our life priorities and make that sort of assessment has been huge for me as well.
How about you, Heather? Who's your support group or person?
Yeah, so I have a pretty tight network of I would call very successful women that are in different career fields, yet we can all bounce things off of each other and share our career experiences as a way to motivate one another, but also provide insight and perspective. But honestly, and I didn't know she was going to be on here today, so this was already an answer I had drafted. So shout out to mom. Hi, mom. It is my mom. My mother has been a true inspiration for me, and being that woman of strength and power. And in her own career, I've seen how she started with a 9-month position at Missouri State as a secretary and worked her way up to the director of her department, and just how impactful that's been. And she's stood by my side. So anytime I have a question or career dilemma, she's my go-to.
Well, obviously she showed up to support you today too. That's cool. Yeah, and I'll just say, and this relates to one of the questions I just saw in the chat box that I'll go to next, but I've mentioned I love getting people together that have different perspectives. Like, I've never been one that wants an echo chamber of people just agreeing with me. I like people that challenge the way I think. And my greatest support group outside of family and faith is I've got a group of women, and we're all from different decades in life. And when we started it, we had one in 20s, one in 30s, one in 40s, 50s. And now we span up to 70s. But we all have that different decade perspective on the same question. And we try to do something, a couple times a year where we just take a weekend and have a girls' weekend with that group. And it's just like so enlightening. And so I think, one of the questions is talking about, getting out of silos. Let me see where it is. Are there women who found that in working on an interdisciplinary level as women in STEM, that we span boundaries and build bridges? Is it possible that we have built internal and professional capacity to hold such varied roles in life? And do we have an advantage in moving in and among silos, or is it a liability in gaining credibility in your field? And that's a great question. And, as one that was called a opportunistic researcher who doesn't have focus, I think I would have probably fallen in that category early on, but now I think it's a huge asset. And I think, there's so many areas in our fields that can be much more efficient and certainly a lot more fun if we work together. Does anybody else have a response to that question in the chat box?
Yeah, well, I definitely agree with you, Caroline. I mean, for me, it's definitely been an asset now in terms of just being able to juggle. I think it's just that mom side, being able to juggle the different projects and not get so, how would I say, just torn apart, because sometimes it looks like some of our male colleagues is like, oh, just can only focus on this project or that project, and so I think, when you shared that thing from your tenure review, mid-tenure review, that they said that, it was like, wow, I think in today's environment, it will be like, wow, that's one thing
Right.
we like about. Yes. So anyway, yes, it's an asset, and I think we do need to capitalize on it more, especially with the tendency to work in silos. We need to be on the forefront of getting out of the silos and working in interdisciplinary teams.
Absolutely. Well, let's talk about, do you have a weekly or daily ritual that you really think helps to contribute to your success? I'm going to throw that one first of all to Natasha.
Yeah, a couple years ago, I actually kind of went through a stage where I was just really depressed in life, and I was very focused on my job, and I was very focused on being a mom. And at this time, my daughter was maybe around 2, so the toddler stage, which is, not the easiest time of life. And I ended up going to a therapist and just talking about things, and realized that I had just kind of let all of my other interests just drop out. And it just wasn't a very healthy place to be. And since then, I've taken back up and started doing some art and doing watercoloring. And I still do this kind of on a weekly basis, where it's just a time to kind of focus on something that I enjoy, and it's for me. And I'm, not the best artist. It's not what I do for my day job, but it helps me get calmed down and just really kind of not think about everything else that's going on. And I think that's really important in order to be a successful person, is to not forget taking care of yourself. And it's easy to do that.
Yeah, the best thing you just said is it's for me. And I think that's very hard for us to be okay with, but it's absolutely, in my mind, essential. How about you, Tayo?
For me, being prepared in the morning helps. And one of the ways I do that is, I'm a person of faith. So just taking that time out in the morning for prayer, meditation, just the quietness really, really, really makes a difference. And also when I come back in the evening after the kids have gone to sleep. And it's so funny because my kids know, my son was like, man, I thought you were an extrovert. Like, mom, how can you? But I'm like, no, I'm actually an introvert because I need those times of quietness to recharge. And I realized that when I too busy and I don't make that time, it's a mess. It's a mess. So I need the time of quietness in the morning, and also at the end of the day with my cup of tea in my chair. My kids have come to respect that. It's part of what allows me to reassess. I'm just a very reflective person, and that's key for my success, I believe.
You just made me feel relaxed just talking this thing. Feel very centered. But yeah, that's great. So I'm going to ask this, and sometimes we get an answer, and sometimes we get something from someone in the chat box. But I'm always curious: is there a book or a podcast or an author that you found to be very helpful? And I think Heather, I'm going to throw that one to you.
Well, this is something I'm guilty of, that I don't take enough time for myself. So I want to hear what everybody else has to say.
Okay.
I definitely enjoy reading, and it's something I haven't made time for in my life in the last few years. And I have a goal of doing that. So I'm excited to hear some suggestions.
I do see Brene Brown is one of the suggestions, and funny you should say that, because I'm kind of a Brene Brown freak myself. And actually, oh, sorry. So this is one of the Brene Brown books, but she's got a series and podcasts. And then I see Jay Shelby. That's not one I'm familiar with. How about you, Amanda?
Well, I was just going to say a lot of that looked really familiar to me. I love that Boundaries book by Dr. Henry Cloud that somebody in the chat recommended. I will say one of the things that I can recommend to anybody who's looking for improvement in this area is to join a book club. It can be an informal thing. It can be a formal thing. You can go on meetup.com to find, some that are meeting in your area. I was lucky enough to know some people in my life who were part of one who invited me to join. And so I think that in my case, we have a book club that we just round robin, every person picks in a different month, and we just meet together once a month and we talk about the book, but we also talk like we're all professional women. So we also take the opportunity to lift each other up and talk about our careers and what's going on in our lives. And I find it to be truly invigorating. I go even when I didn't read the book that month, just because it's so nice to be around, just like today, a group of professional ladies who have unique perspectives, and I can learn from them. I can share with them challenges I'm having, and they can help me with that. So just for the camaraderie, it's great to be part of a book club, but also, reading 12 books a year really feeds my mind and my brain as well. And it does give me a good excuse to make sure that I have read that book that month. So regardless of what else I'm doing, it's a good reminder to do that and a good excuse to do that.
Yeah, and the variety of books I think is important, because I think we can sometimes get stuck into one. I do a lot of Audible books because I'm like always multitasking, and that's a whole nother discussion. But I can go for a run and put on an Audible book, or go for a bike ride, and to me that's a way to kind of get recentered. All right, we're gonna make time for some questions, but I want to wrap up with each of you and ask you the one question: what's one piece of advice that you would give to a woman who is either working in STEM or considering a career in STEM? And Taya, I'll start with you.
Don't give up. It's gonna get hard sometimes. It's gonna get hard along the way. Just be tenacious. Don't give up. Persist.
That's awesome. How about you, Natasha?
Yeah, I think it's important to be flexible. Realize that, at a given moment, your job or career may not look like what you want it to look like, but you can keep working, and you don't have to give up and say, this is the end. I'm just an adjunct and I'm going to end here. No, if you have a goal in mind, you really can move past that, but be a bit flexible and be okay with where you're at when you're at there, because sometimes you can't help where life gives what life hands to you. But I think that flexibility is key.
Amanda, what would you add to that?
Well, I want to echo Tayo because she had great advice, which was don't give up. My add to that would be to say, give yourself time to fail and opportunities to not be good at something. Give yourself some credit for the fact that you're practicing a new skill. And just because you don't get it right and perfect the first time, a lot of us are perfectionists, and, take a deep breath and say, you know what, I'm practicing this thing. And so I'm not going to be perfect at it until I've practiced it a lot. And so give yourself some opportunity to do that and just to get better at something through practice.
And Heather, I'm going to let you finish this off because I want to hear what you say in front of your mom. And I'll be interested to know if it's something that you learned from her.
It absolutely is something I learned from her. Working at a university, my mother always said to diversify yourself as much as possible, and to never close a door, and to reject opportunities that were put in front of you, even though they may not appear to be right out in your lane. That exploring those opportunities oftentimes leads to some of the biggest growth you may have throughout your life. So, and I can completely agree with that now, sitting where I am today. This is the last position I ever thought I would hold in a research and statistics background. I left grad school thinking it was the last thing in the world I would ever do, and I was going clinical, and that was my route. But here I am, and I love it, and I'm thriving and enjoying it every day.
And I'm guessing that all of us, if we went around the boxes here, would say, I wouldn't change it. All the things that were so difficult were actually necessary to get me to this point. And to me, life is just a constant learning experience. And I'll leave you with one of the lines I use especially when I travel. I always say, we're either going to have a good time or a good story. And if we do it right, we'll have both. And so if you, even in the bad times, say, okay, well, you know what, this is going to be a good story someday. And there's something I'm supposed to learn from this. And all I got to do is be a better person tomorrow than I am today. And Dean, I'm going to open the rest up to you to get any of your comments or further questions that I may have missed.
Look, y'all are so inspirational. Thank you. I love this discussion. I can't wait to watch it again. Ellie's going to be sending out the recording to everyone. I wrote down all the stuff in the chat box, but Carolyn, thank you so much for being our keynote speaker and our moderator. You're a total rock star. And all of you ladies, I can't thank you enough. This was such a great way to kick off WISER 2022. So I'll just tell everyone to be looking for other dates for our WISER events in our newsletter and in our emails. And everyone, please stay safe and warm out there, because it's now lightly snowing outside my window after the sleet. So everyone take care. Thank you so much.
Thanks.
Thank you. Thank you.
It was an honor. It was an honor to work with all of you. Thank you.
Thanks.